Hello everyone, welcome back to my channel. So in this video we will be discussing about the pharmacological actions of histamine. It has so many actions. We will be discussing on different things, like on the blood vessel we will be discussing first. So histamine, it causes the dilatation of the smaller blood vessel, which include arteriole, capillaries and venule, and on subcutaneous injection there is a flushing, especially in the blush areas like heat, increased heart rate, cardiac output, and there is no fall in the PPR produced. But when there is a rapid IV injection, there is a fall in BP, and this fall in BP has two component. One is early, short-lasting H1 component, that is because of H1 receptor when histamine is acting on H1 receptors, right? And there is a slow but more persistent H2 component. Okay, and when we give low doses of histamine, so there is a fall in BP. So only H1 component है. So we can if only H1 component is manifested because of there is a higher affinity of H1 receptor on histamine, and fall in BP due to the larger doses, it is completely blocked by combination of both H1 and H2 antagonist. Okay, so like many other otacoid, there is a vasodilatation, ठीक है, that is caused by histamine. It is partly because of H1 component and indirectly mediated through EDRF. What is EDRF? It is endothelium dependent relaxing factor, which means nitric oxide, and the receptor for which present are endothelial cells. Okay, this is mainly because of H1 component, but the H2 component, it has a direct action on the vascular smooth muscle cells, and when we inject it intradermally, it has a triple response. And about this triple response, we had discussed in physiological classes that it has red spot, wheal and flare. And the red spot, it is because of intense capillary dilatation, and the wheal, that is because of exudation of fluid from the capillaries and venules. And flare, it is the redness on the surrounding area, that is because of dilatation of arterioles, that is mediated through axon reflex, that also we had discussed in physiological classes. Now the action on hurt. So in situ hurt that is present in our body, it has no direct effect, but on the isolated hurt, especially of guinea pig, the rate as well as the force of contraction is being increased. That is mainly because of H1 component, H2 component, sorry. And the visceral smooth muscle, there is a bronchoconstriction. So in the patients of asthma, they are highly sensitive, and large doses they causes abdominal cramp, okay, by increasing the intestinal contractions. And the smooth muscle contraction, this response is a H1 response mainly. Other than few H2 mediated relaxation is also seen, like bronchial muscles of shape and human bronchi after H1 blockage when H2 response is unmarked. On gland, so they mainly act on the GI. And histamine, they cause a marked increase in gastric acid secretion, mainly the acid secretion. Okay, and that response is because of H2 receptors. There is a direct action of H2 receptors on parietal cells through and that is mediated by increased CAMP levels. Okay, and which in turn also activate the proton pump that is present on the membrane of parietal cell. The proton pump is hydrogen potassium ATPase. Histamine can increase other secretion, but the effect is hardly seen. And now the action on sensory nerve ending. So whenever we are giving histamine, we are injecting it intravenously or intracutaneously. So the action on sensory nerve ending, itching, higher concentration, when we are giving histamine intravenously, itching occurs, and at higher concentration when they are injected more deeply, so they can also cause pain. So these are reflections of capacity of histamine to stimulate the nerve endings, right? Autonomic ganglia at adrenal medulla, so they stimulate and release of adrenaline, that can cause a secondary rise in BP. On CNS, though, so there is no central effects which are being produced. However, intracerebroventricular administration, it produces rise in BP, cardiac stimulation, behavior, arousal, and hypothermia, vomiting, and ADH release. So CNS, there is no central effect. Kyun? Because it cannot cross the blood-brain barrier. Hello everyone. Now we will be discussing about the pathophysiological roles of histamine. So on gastric secretion, we had discussed that it has a dominant physiological role in mediating the secretion of HCl because it increases the secretion of HCl through H2 receptors, and these H2 receptors, these are non-mast cell histamines which are occur in the gastric mucosa. They are possibly in the cells which are known as histaminocytes, which are present very close to parietal cell. Okay, and this histamine has a हाई टर्न ओवर रेट. वी हैड डिस्कस दैट जो नॉन मास सेल हिस्टामिन होते हैं उनका जो टर्न ओवर रेट होता है दैट इज़ वेरी हाई. सो H2 ब्लोकर्स, अगर H2 रिसेप्टर्स के स्टिमुलेशन से थ्रू हिस्टामिन अगर HCl का सिक्रीशन ज़्यादा हो रहा है तो टू ब्लॉक दैट वी हैव टू गिव H2 blocker which not only suppress the acid secretion but induced by the histamine but also mark diminish that is response दैट इज़ बिकॉज ऑफ गैस्ट्रिन एंड एसिटिलकोलिन. मतलब क्या है कि ये तीन चीज़ें होती हैं, एसिटिलकोलाइन एंड गैस्ट्रिन एंड एज वेल एज हिस्टामिन, तीनों के तीनों गैस्ट्रिक सिक्रीशन को इंक्रीज करते हैं मेनली ऑफ HCl बाय एक्टिंग ऑन द प्रोटॉन पंप. तो दे उनके अपने अपने रिसेप्टर्स होते हैं, बट दिस H2 ब्लोकर दे डोंट ओनली सुप्रेस द एसिड सिक्रेशन विच इज़ इंड्यूस्ड बाय हिस्टामिन, क्योंकि ये हिस्टामिन के रिसेप्टर्स को ब्लॉक करते हैं, बट दे ऑल्सो सुप्रेस द रिस्पॉन्स दैट इज बीइंग प्रोड्यूस्ड बिकॉज ऑफ एसिटाइलकोलिन एज वेल एज gastrin, right? So now the action on allergic phenomena, this is a physiological role that mediation of hypersensitivity reaction was the first role that was assigned to histamine. It was very important, but only this is the only mediator of this kind of phenomena. So when they are released from the mast cell, they follow an antigen antibody reaction on their surface, and this is mediated by IgE type of antibodies. So in immediate type of hypersensitivity reaction, so histamine is a causative in urticularia and angioedema and bronchoconstriction, anaphylactic shock, and histamine and H1 antagonist होते हैं, they are very much effective in controlling these manifestation to a considerable extent except asthma and to a lesser extent anaphylactic shock in BP. Okay, now the role of histamine as a transmitter. So histamine is believed to be an afferent transmitter which initiate the sensation of itching and pain at the sensory nerve ending. हमने पहले भी पढ़ा है that when this kind of reflections of the capacity of histamine, वो कितना sensory nerve endings को stimulate करते हैं. So non mast cell histamines होते हैं, they are present in brain mainly in the hippocampus and midbrain. So they are maintaining the वेकफुलनेस. अगर H1 एंटागोनिस्ट आए, उन्होंने एक्ट किया ऑन दिस काइंड ऑफ H1 रिसेप्टर्स विच आर प्रेजेंट इन द ब्रेन, तो वो उनके जो ये फंक्शन होता है दैट इज़ मेंटेनिंग ऑफ वेकफुलनेस, उसको ये ख़त्म किया. सो दे विल कोज सेडेशन बिकॉज ऑफ ब्लॉकेज ऑफ दिस फंक्शन, right? So the action, inflammation, mediator of vasodilatation, other changes that occur during inflammation, these are the mediator of that we had discussed, and they promote the adhesion of leukocyte to the vascular endothelium because of some selecting protein we have studied in pathology about p-selectin. Okay, right? So on tissue growth etc., the growing and regenerating tissue, they contain a high concentration of histamine, and it has been suggested to play an essential role in the process of growth and repair. Headache, histamine has been implicated in certain type of vascular headache that there is no evidence of it. Okay, so that's all for this video. Thank you for watching and please subscribe to my YouTube channel.